Patient safety is a healthcare discipline in the healthcare sector that applies safety measurements to achieve the goal of delivering effective healthcare. The importance of patient safety in healthcare settings is essential due to the number of injuries or even deaths occurring in healthcare settings. This video presentation will cover various aspects of patient safety. These aspects include medication, rule clarity, infectious control, and technology.
Hi, Tommy. I am Dr. Kimmel. How are you feeling today?
Hi, Dr. Kimmel. It is nice to meet you. I am actually not feeling well today.
Okay, what type of symptoms are you currently experiencing?
Dr. Kimmel, I am constantly coughing. I have a sore throat and a stuffy nose. Not feeling well at all.
Hi, Dr. Kimmel. I am actually heading out right now to Tim Hortons. I am going to get myself a coffee. Hopefully, I will win something from Roll Up the Rim. I have been buying their coffee for almost 3 years now, and I still haven't won anything. I guess I am not that lucky. I wanted to ask you if you wanted me to get you anything from there.
No, thank you, Dr. Fallon. I am busy today.
As shown in the clip, the physician named Dr. Fallon was interrupted by another physician named Dr. Kimmel while he was asking questions to his patient Tommy. According to Freeman and his colleague, the leading causative factors correlated with medication errors include interruptions, distractions, and communication. However, with interruptions being significantly impactful on the medication administration, this study conducted by Freeman and his colleague emphasized on the issue regarding the interruptions that occurred during the medication process, and so they address a bundle of interventions to determine if they can help reduce the interruptions. The bundle of interventions included lighted iron yards worn by nursing staff, no interruption zone, phone scripts, patient and family educational brochures, EMAR review, a scripting card, letters to stakeholders, and lastly, unlicensed assisted personnel. According to researchers of the study, it was found that with these interventions, it will successfully help to minimize the interruptions and errors. Another issue that was found in this video clip was that while Dr. Fallon was asking questions to Tommy was hesitant and was unable to recall his medication history. According to Santafont and his colleagues who conducted a study, they found 3 sources of medication errors, one of which includes where patients are unable to provide necessary information to caregivers, which in turn leads to incomplete data and incorrect prescribed medication. Another source of medication error include a reduction in staff members that lead to more errors and complications because many hospitals that are understaffed are using temporary staff or contractors who may have less knowledge about the protocols and the types of systems used in the settings. And lastly, a rapid change in practices and the lagging infrastructures and instability within the circle of clinicians lead to intrinsic uncertainty and errors in the healthcare industry. Based on these sources of error, the researchers addresses ways that can be used to reduce them. These strategies include proper education of medications, adapting to new safety systems and technology, and lastly, ensuring that a clinical pharmacist has a role in the medication process. The last issue shown in this video was that Dr. Kimmel prescribed the medication without involving Tommy in the medication process, and the physician did not give Tommy an opportunity to ask questions in regards to their prescribed medication. According to Franklin and other researchers who conducted a study that involved 100 patients and 104 healthcare professionals to examine the extent to which hospital patients were involved with medication safety related behaviors, the extent to which they wanted to be involved, as well as the extent to which healthcare professionals would support patient involvement. They found that most of the patients and healthcare professionals appeared to be supportive of hospital patients being involved in the medication process. However, there was a substantial gap between patients' preferred and experienced engagement with inpatient medication, which was shown in this video. This could possibly be due to the findings found from a constructive grounded theory study that looked at the perceptions of healthcare providers. They found that healthcare providers' perception was on evaluating the patient's level of interest on the medication, assessing if patients can or cannot engage in the medication process, and lastly, having to deal with matters of time, power, and control. Therefore, by implementing various strategies and/or interventions to prevent any barriers such as interruptions from occurring, by having an effective communication and gathering accurate medical history, and lastly, by involving the patient during the medication process to make effective decisions, can all help in maximizing patient safety and minimizing medication errors and potential harms.
Hi, Tommy. My name is Susan and I am one of the nurses who work in this unit. How are you feeling today?
Hi, Susan. I am not feeling well today. I came in yesterday and Dr. Kimmel prescribed me a medication. I know. Have a major headache and I feel really dizzy.
Okay, Dr. Kimmel will be with you shortly.
Hi, there. I am Dr. Fallon. Are you John by any chance?
No, I am Tommy.
Oh, sorry, Tommy. I thought you were John.
It's okay, Dr. Fallon.
In this scenario, it was seen that there was no responsibility in roles. Nurses did not know how to communicate with the patient. Overlapping of roles was seen between physicians and nurses. There was no head nurse or leadership roles. Healthcare entails many different professionals that all have one united goal, which is patient safety and centered care. Working alongside others in a professional atmosphere can be rewarding. However, among working within a team, there can be certain challenges that arise, such as intertwining of roles, responsibilities, and/or activities, incompetency among the group and its outcomes, lack in leadership, and confusion among the professionals. These challenges may be overcome by introducing role clarity within the team. Role clarity entails identifying each person for their role and responsibility. Having a clear, distinct role helps clear up overlapping to achieve excellence. Role clarity among staff can cause there to be decreased confusion and ultimately increase the safety of the patient. Team leaders with role clarity are powerful forces that can bring about change within the system and encourage more role clarity to further enhance patient safety management and quality of care. Improving safety among patients can be facilitated by individual learning from errors previously made. Among teams, there must be role clarity and leadership to facilitate a meeting and/or a discussion regarding patient safety concerns that may arise. Organizations need leaders who can promote patient safety culture. Leaders may do this by articulating shared values and modeling appropriate behaviors, an example being enhancing teamwork and transparency among the team. More importantly, establishing expectations for staff, such as role clarity, so each and everyone knows what their role is in accordance to patient safety. Leaders may also advance patient safety in how to set goals and establish priorities, allocate resources, and develop plans among the team members. Organizations dedicated to patient safety articulate this as a centralized goal and then further develop strategies and translate that goal into specific actions to achieve the goal. A leader provides strong role clarity, which is also essential to safety as they are correlated. Again, role clarity enhances competency in one's roles and responsibilities, therefore they can make confident, autonomous decisions regarding a patient's health.
Hi, Tommy. You're back already. What happened?
I am allergic to the medication that you had prescribed me yesterday. I have a major rash in my body. I feel like I want to vomit, and I have a headache.
Oh, really? Where are the rashes located?
It's all over my chest, legs and arms.
Okay, I am going to prescribe you this special cream that I want you to use, and I want you to apply it 3 times a day.
Okay, thank you, Dr. Kimmel.
As seen in the video clip, Dr. Kimmel walks into the room and begins to assess Tommy without washing his hands. Once Tommy informs Dr. Kimmel of his rash, Dr. Kimmel begins to touch the rash without wearing any gloves. After prescribing Tommy a cream to treat his rash, Dr. Kimmel leaves the room without washing his hands or using any hand sanitizer. Infectious control is an important component of patient safety, and in this scenario, it is clear that infectious control measures were not being followed. Dr. Kimmel is putting himself, Tommy, and other patients at risk by not washing his hands before and after assessing Tommy. 5 to 10% of hospital patients develop a healthcare associated infection, or HAI. Although that percentage does not seem high, it is equivalent to 100,000 deaths each year in United States hospitals. To reduce the incidence of HAI deaths, it is imperative that infection control standards are implemented and followed in healthcare facilities. The World Health Organization's first Global Patient Safety Challenge, created in October 2005, focuses on raising awareness about the importance of preventing healthcare-associated infection and outlines practices that should be adopted to decrease the incidence of infection. The World Health Organization outlines simple strategies such as hand washing, blood injection and immunization safety, and waste management safety that can be utilized by any healthcare organization to improve patient safety. These strategies can be implemented in any healthcare setting to reduce the spread of infection. Furthermore, a study conducted by Missit et al. Determined the impact of a 5-year quality improvement program on nosocomial infection rates in intensive care units, or ICUs. The researchers aimed to determine how compliant nurses and doctors were with infection control practices and whether this compliance had a long-term impact on the rate of nosocomial infection in severely ill patients in St. Joseph Hospital located in Paris. Infection control practices were determined by the ICU staff based on Centers for Disease Control recommendations. Some of the practices included ensuring that sterile water and devices were always used, hands were washed before and after having contact with each patient, and lastly, wearing a gown and gloves when required. As a result of these practices, the incidence rates for UTI, CDC-related bacteremia, and CDC colonization were reduced significantly. This illustrates that having an effective quality improvement team who follows standard infection control practices can lead to a reduction in infection transmission within the hospital. The infection control practices used by the healthcare staff in this study are easy to implement in any other organization, and this study illustrates how even simple practices such as hand washing can reduce infection transmission. Staff compliance with infectious control measures is also very important. Some evidence-based infection control practices set out by the Centers for Disease Control include educating staff on infection control practices, ensuring that a checklist is utilized to make sure that staff is complying with procedures, and providing feedback to staff on whether or not infection rates are decreasing. Once these practices were utilized, the incidence of catheter-related bloodstream infections decreased in intensive care units throughout Michigan. Staff compliance to safety procedures is essential to maintaining infection control standards, and the practices discussed can be applied in many healthcare organizations in order to reduce infection rates. A study by Bryce et al. Aimed to determine whether infection prevention and control, or IPC, programs save money for healthcare organizations. Even though IPC programs can be expensive to implement, they are thought to save money because if the rate of infection in hospitals decreases, it is also assumed that the length of hospital stay will decrease, and thus so will expenses that are associated with healthcare-acquired infections, or HAIs. In order to determine whether IPC programs lead to a decrease in HAIs, a cost-benefit analysis was undertaken over 4 years, focusing on Vancouver Coastal Health, a regional health authority. The IPC program budget was $6.7 million over the 4 years, and in total, $9.1 million in costs associated with HAIs was avoided due to successful implementation of IPC programs such as ones described previously. It is thus clear that although IPC programs are costly, they are ultimately beneficial.
Today, there were a lot of issues in regards to patient safety.
Yes, I noticed that too, Dr. Kimmel.
I wonder why and what we can do to improve it.
Health information technology has potential to benefit patient safety. With technology, we are able to improve safety of every patient. by improvement in the medication system, so there isn't any errors within the distribution of medication. Technology also improves the workflow between healthcare takers because it allows them to distinguish the roles digitally. The advancement of technology also improves resources for healthcare teams to continue with updated training. With new implementation and improvements within HIT, we are able to keep medical history safe and secure for patients, so patients can be cared for and tended for without any hiccups. Overall, implementation of health information technology will improve patient safety by reducing the amount of errors done on a daily basis. Health information technology within healthcare teams allows clinicians to improve the clarification within their roles in healthcare teams. It allows clinicians to provide better treatment through health information technology, with HIT being able to distinguish roles and reduce the amount of confusion and conflict that can occur within the work environment so patients can be cared for. With newer technology being introduced, technology has advanced to the point where clinician training can be improved through technologies for any clinician, physician, or manager. New clinical decision support systems or information systems aim to improve decision making towards diagnosis, such as prevention, disease management, and treatment. They're able to track their feedback from surveys to where improvement is needed within the healthcare team or facility.
The healthcare system entails a team of interprofessionals whose goal is providing quality care to patients. Issues may arise such as patient safety concerns. Patient safety is a broad subject and many subtopics have to be considered. Topics include medication, role clarity, infectious control, and technology. Role clarity can enhance team functionality and decrease confusion and lack of competency of one's roles and responsibilities. Technology such as databases and EHR can then further decrease confusion of information between departments. Technology can also improve patient care as physicians will be notified before a medication error is about to occur. Lastly, infectious control is clearly engaged with patient safety as the patient needs to be in a safe and controlled environment.